Jesus in your Christmas. Put Jesus in your Christmas. Put Jesus in your Christmas this year. Came down here to save us from wickedness and chaos. Put Jesus in your Christmas this year. Put Jesus in your Christmas. Put Jesus in your Christmas. Put Jesus in your Christmas this year. Came down here to save us from wickedness and chaos. Put Jesus in your Christmas. Put Jesus in your Christmas. Put Jesus in your Christmas.
Good song, yeah. All right. So, the Ministry of Health is urging individuals with non-communicable diseases to continue taking their prescribed medications during the holiday season. So, we do have in studio this morning Dr. Maria Clapperton, Director of the NCD unit, and we have also Nurse Sherma Alexander-Campbell, National Administrator, Nursing Services. Ladies, thank you very much for coming this morning.
Thank you.
Yeah.
Thank you for having me.
And you know, ladies, while I'm listening to that song, I'm seeing you all listening to, and I'm saying, yes, all of that is good, but you need to be concerned about your health during this Christmas season here, because, Doctor, we do have a way of overdoing at this time of the year, right?
Yes. So we want everyone to enjoy their holiday season. Of course, eat, drink, be merry, spend time with your family. But we're just here to remind you, especially persons with non-communicable diseases, chronic conditions that are on medication, to continue to take your medication and enjoy the festivities in moderation. I think that would be the key operative word here, enjoy in moderation.
Yeah. Nurse, what's your message here this morning?
Very similar to Dr. Clapperton. Continue taking your medication, because even if you want to have, as we do, all the nice things, the rice, the macaroni pie, the potato salad, then followed by the cake and ice cream, it's about moderation. So it's not about, we don't want to see in our A&E departments come the new year, later on in the new year, but we want you to enjoy the season, but a little bit of rice, maybe miss out on the macaroni pie this time because you're planning to have some cake afters.
All right. You hear what the nurse has said, eh? But what do you see during this time of the year? Do you see an uptick in people coming to the medical institutions for assistance, for help?
Usually,
the treatment?
For outpatient clinics, it's usually quiet.
Yeah.
Persons who are regularly scheduled may come or more likely to miss their visits, because persons tend to be of the mindset that I don't want to be kept in hospital over the holiday season.
Right.
So they get caught up with their shopping and all of the things that, to prepare for the holiday season, and tend to neglect their health in that way. What we do tend to see, though, is after the holiday season, as Ms. Campbell mentioned, we do see a lot of persons then coming in with elevated blood pressures, elevated blood sugars, because they may have neglected to take their medication, missed their doctor's appointments, have not filled their prescriptions, so they have to now or be prompted by an emergency to present to a hospital to then get back control of their conditions. So this is why we're reminding persons, because that is the phenomenon we're trying to avoid at the turn of the new year. So, and again, the message is moderation. We're not telling you not to have the cake.
Yeah.
We're not telling you to enjoy yourself. No, don't have your punch a creme and to cut out. We're saying go ahead, but in moderation. Just be mindful and make healthier choices if you can, but all in moderation. And remember to take your medication. Do not discontinue your medication because you want to enjoy yourself for the holiday season.
Yeah. What's the demographic that you've been seeing most affected by this?
Well, traditionally, non-communicable diseases affect more the elderly.
Yeah.
50, 55. But we are seeing some of the younger individuals who also having diabetes as well. So those are the population that we're really speaking to with non-communicable diseases. We want you to continue to be healthy. So if throughout the year you have been keeping your appointments, you have been taking your medication, we want you to enjoy the family time, but we don't want to see you in hospital come the turn of the new year. So it's really important that you continue those healthy practices even during the season.
Yeah, but you know, Dr. Clapperton, it's not the first time, and nurse, this is not the first time that we're speaking about it. I suspect last year we had a similar conversation. But have you seen any improvement in the attitude of people?
I think behavior change is something that is challenging across the board. And the reason why, as you mentioned, we were here last year and we're here again is because you need to continue to encourage persons and to remind them, because people can get carried away. Some may miss the message, and you have to continue to spread that message and encourage people. So some may make a change, and then you may be unable to continue. You may fall off a little bit, and if you do fall off, we want to encourage you to keep going. So we continue to motivate and encourage.
Yeah, but as in a general context now, as it relates to NCDs in Trinidad and Tobago, are you seeing a decline? Are you seeing an increase? What are you seeing in a general sense?
In a general sense, I would still prefer to have the data to speak more, comprehensively on it. But what we do know is that, like all other countries, NCDs or non-communicable diseases continues to be a major health challenge. And it's something that we have to continue the work in, and it will probably be something that we will have to continue to put our efforts towards for a very long time.
Yeah. I want to speak a little bit about the impact that the NCD has on the individual. Mm-hmm. Yeah. The risks, some of the other health problems that they cause. Just lay it out on the table for us, doctor, so that people understand what we're speaking about.
So first of all, non-communicable diseases is not one disease. It's a group of diseases that are not infectious, cannot be passed from person to person, and are of a long duration. The most common, or the top 4 major causes of NCD-related deaths in Trinidad and Tobago, according to a CSO report of 2018, we still have, diabetes at the top of the list, cardiovascular disease, primarily heart attacks and strokes being there, and also cancer. So a lot of our population, a lot of persons have diabetes. I'm sure a lot of people listening know at least one person who has diabetes or has high blood pressure or who would have had a heart attack or a stroke. And heart attacks and strokes are complications of uncontrolled conditions like uncontrolled diabetes, uncontrolled high blood pressures. So this is why even if you do have diabetes or high blood pressure, we encourage you to comply with your doctor's instructions, comply with the management, even if you're on medication, so that you can bring your blood pressures and your blood sugars under control and reduce your risk of experiencing complications like heart attacks and strokes.
Nurse, I'm sure that you would have heard people saying that I'm feeling good, I don't need to take my medication.
Yes, and you will have individuals who have chronic hypertension will tell you, I know when to take it. When I get that pain on the back of my neck, I know my blood pressure is high, so I will go and take my blood pressure medication. And that's really not the way to manage your disease, because it's really about allowing your body to cope with that high blood pressure over time so that you continue to take your medication, not just looking at symptoms, but continue to take your medication and know what your blood pressure readings are as well, so that you know for yourself, okay, things are looking as if it's going up. Let me continue my exercise regime, continue to drink my water. Those are some of the things that you will use to control your blood pressure over time, as opposed to looking just at the symptoms, because you never know, that might actually, you may not catch it in time and your blood pressure may be too high, leading to a stroke.
Yeah, so you need to be consistent.
You need to be consistent.
Ladies, anything additionally that you'd like to tell us this morning before you leave us?
Well, just to re-emphasize that we would like to remind persons, especially those with non-communicable diseases, as the holiday season is fast approaching, to continue to take your medication and enjoy the season, but do not overdo. Eat, drink, enjoy yourself, but everything in moderation.
Yeah, Nurse?
Yeah, and again, we want to encourage people to move. So even after you've had that meal, have a game with your children. Have a game with your grandchildren, rather than sit back on the settee and fall asleep.
Yeah.
Get moving so you can burn off some of those calories.
I could see
and
them
maintain
now.
that.
I could see them how they're lolling off. Yeah, you could see them. I know what is going to happen, nurse and doctor. But thank you very much for the message this morning. And to our viewers, take the message. It's free, and it can save your life, right?
Absolutely.
Correct.
Yeah. Thank you very much, ladies.
Thank you.
We're coming back, everybody.
Wickedness and chaos, put Jesus in your Christmas.